to your question about where we are in terms of capacity, our capacity is actually very high.
Yes.
If you look at the healthcare professionals in this country, and this is guided by the Kenya Medical Practitioners and Dentists Board.
Yeah.
Exactly, yeah. That ensures that every medical practitioner working in this country renews their license on an annual basis. And before you renew your license, there's something you need to do. There are some trainings that you should have already met before. So, and once you take up a training, they award continuous professional development points, and these add up towards you meeting the criteria for your license renewal as well. So our capacity is very high. Where we fail is lack of the proper tools. For example, medical doctors who are working in public health facilities, they don't have the required resources to offer the services that is needed, badly needed by the communities that they serve. Some of them may not have simple things like linen that is required for theater. And you'd find very needy cases of communities coming towards seeking services in those facilities. Other places, simple things like cotton wool, like you go to some facilities and when a client is admitted or a patient is admitted, their relatives are given a long list of things that they need to buy. Come with a basin, come with slippers, come with cotton wool, come with spirit, come with needles, come with sutures, come with your normal saline, even the drip itself.
Yeah, even the drip, you're told come with it.
Exactly, and that's a very sad state of affairs in this country at the moment. And that's what we are calling towards all leaders, towards. We would want the Kenya that we foresee, or the Kenya that we want, is that each of us should be able to access high quality services at the nearest health facility.
That's it.
Yeah.
Pretty much. All right, let's move briefly then and talk about what your social impact has been, especially since you entered this particular space, and it's been 30 years.
Yeah.
That's a long period. In fact, when you talk about 30 years, you say, well, now you're the experts in that particular field. How would you briefly then talk about your social impact through marketing or PS in the country?
PS Kenya, we are very big in social marketing of health commodities. Some of the commodities that we are known for are condoms, specifically trust condoms. And looking back, being in this country for over 30 years, about 15 years ago when we brought in the trust condoms, that time it was unacceptable for somebody to talk about condoms in an open space. There was a lot of stigma towards that conversation, but now it's a very easy conversation that we can have at household level. Personally, even with my children, it's a very open conversation that we can have. And these are some of the advances, because the minute we deal with that stigma, we're already starting to address the issues as they are. More people now are taking up condoms. You've seen now there's a vibrancy in that space. In addition to trust condoms, there are many other condoms that are easily available in that market.
Yes.
And now Kenya is actually running itself. We are not depending strongly on donors towards coming to support us to purchase commodities like condoms. The other space we are in is in family planning commodities like FemiPlan, still under the social marketing docket. FemiPlan pills, these are commodities that we distribute or we sell through the local pharmacies. And one unique thing you'll realize about PS Kenya, we ensure that we have high quality products at a very low price that is easily affordable to the Kenyan market. And that's a big thing. Commodities like in the water category, where we have commodities like WaterGuard, which is easily accessible to any household in this country to ensure that there's access to clean and safe water at household level, so that we can end diseases like diarrheal diseases that end up causing high childhood mortalities when children are very young. In social marketing, for example, in the last 10 years, we have distributed over 200 million condoms, which is significant. It is a lot.
That's a lot, isn't it? That's a huge number that should be celebrated.
Exactly.
Yes.
And as we celebrate this, we are also seeing in the country that the burden of HIV has also decreased. It's going down. The number of cases we used to report many years back of new HIV cases was much higher than we are seeing right now. So the prevalence of HIV in this country has also gone down because of efforts or the work that PS Kenya has done in collaboration with many other partners. There are many other NGOs, many donors who have put in their resources in this country towards reducing that burden. Another space we are in the social marketing space is in HIV self-testing. I think you probably saw one of the adverts of Chukua Selfie.
That's it, by the way. Yeah. Oh,
Exactly.
you're the one behind that.
Yes.
And it's quite effective as well, isn't it?
Exactly.
And the
exactly.
conversations like this are the ones that you want to achieve through majority of your campaigns, isn't it?
Exactly.
So you can actually
yes.
get to gauge your social impact then. Because I'll be one of those who will report that it was quite intriguing. You know, I would say, what is this thing about Chukua Selfie?
Yes.
And a majority of young people, and you actually did speak to them directly, yeah, to the point that guys in the state would tell me, Simba, have you taken a selfie? Like, umechukua selfie? And I'll
Fantastic.
be like, yeah, I have.
Yeah. So that is us.
Yeah.
That's PS Kenya, yes,
Ah,
with Chukua
fantastic.
Selfie. Yes.
Yeah.
And right now, with the COVID, the cases of COVID that we have seen, we now have a Chukua Chanjo campaign that is currently ongoing. Chukua Pata Chanjo, Tuwe Chonjo. Be vaccinated, because you realize when COVID was at its peak, many people came and took up the first dose, and others came for the second dose, and minimal came for the booster dose.
Yeah.
So we are working in that space with support from various donors towards ensuring that people complete that vaccination. So those are some of the examples of the social campaigns that we have run over the years.
Yes.
Previously, or way back, we were known for Wacha Mpango wa Kando campaign that was still PS Kenya.
I can remember that.
Good one. Good one. Yeah.
Yeah, I can remember that.
Yeah.
Anyway, it's quite